Well, because you guys do waxing too, right?
Mm-hmm.
So this isn't like a proven fact. Like you don't learn this in the textbooks, but I notice when I've waxed somebody so many times, one time they bruise horribly. They're right around their period time. It's just different.
Oh, okay.
Ask them, are they right around?
Like,
Yeah, just all of a sudden.
On the bone or anything, it just will bruise.
Mm-hmm.
It will bruise.
Yeah.
Yeah.
I mean, there's just sometimes people, oh, she bruised me. I mean, but if you say, I mean, you can wax somebody so many times, and all of a sudden they do, and they'll say, well, I did change my birth control, or well, I did just about to start, you know, that's why I got in here. People that have PCOS with cysts.
I have that.
Me too.
Yeah.
Really?
It's hurtful.
Yeah. PCOS, you don't realize how common it is until you do hair
A
removal.
lot of people have.
So I do a ton of it.
I've had to do laser hair removal on my face.
Yeah.
Yeah, I
so
get
like
hair
women with
here,
full all the way.
here.
Mm-hmm.
When a cyst
Ruptures.
rupture,
Oh my
anything,
gosh.
it's just it's
the
releasing
worst.
that hormone. So they always have that hormone kind of going through them. So
I
My
have
breasts always hurt. How about you?
to- really, I don't really experience
See,
that, but I
see,
have
that's
to be on birth
that's
control.
when mine hurt. I know something's going on. I'm probably growing a cyst, and I'm not diagnosed with PCOS, even though I had hair and.
You have like all of the symptoms.
Yeah,
So I
sometimes
breathe
they
it in
don't-
right
They
when
don't catch it.
They don't catch it. I don't have like a cluster, cluster of cysts.
Mm-hmm.
So you don't have PCOS. So
Did you get a frog in your throat, Kimmy?
I breathed in like spit in my.
Yeah, it was actually an esthetician that said to me, like, you might have PCOS.
Yeah,
And
and,
then I
as
went to a doctor.
esthetician, mm-hmm.
Yeah, my doctor missed it for years.
Yep,
I feel like I do.
you really do help
I
people.
really feel like I have
You
PCOS.
could.
You could, and you don't
I
have
need
to
go
have.
To a gyno, though, like for sure.
Yeah.
You don't have to have the basic symptoms of PCOS to have it, but mostly it's like a larger through here, upper body more so, facial hair, like you'll see some of that. But a lot of times that's just good old grandma and grandpa, you know, like genetics. So, because we're all like a Heinz 57. So.
Yeah, it's bad. Literally.
Our
Yep.
DNA is
Yep.
trash.
So what do you think of
Mine's
those
crazy.
at-home, like, microneedling
Um,
rollers you can buy?
Don't recommend those to people, only because it's very superficial. So just the epidermis,
Right.
and they would have to go slow.
Yeah.
Like, so I would just say don't do it.
Right.
Because if they do it and they're like, well, my friend's an esthetician,
Yeah.
they need to go really slow, and it's good for maybe some product absorption, but I just wouldn't. Just like they say, oh, I dermaplane myself at home. Girl, you're using an eyebrow comb.
Yeah.
You know, you're not using a
You're
dermaplane.
not even putting the right thing on your face.
Because it's more, I mean, it helps some of that fur, but it does not, it's
Cool.
not that like scalpel
Yeah.
type
Right.
training
Yeah.
and knowing what you're doing, okay? So I'm just putting like a serum of hyaluronic acid on her, and this is like a basic microneedling that I do, okay? So I'm just kind of go on her forehead first.
What brand do you use for this?
This one's an Image. It's just a there's a lot of really good brands out there.
When I took my dermaplane class, they used Image.
I
Mhm.
love Image. I use it every day.
I do too.
They used
But there's some good stuff out there. And this hyaluronic acid, which you know absorbs, holds water, so it helps with that plumping. I like to use it. I use a ton of these little guys.
Oh yeah, we used it.
It's just, it looks better than paper towel too, you know?
Yeah.
Like,
Yeah. Pepper towel's pretty rare.
yeah, hot towels are nice too. Okay, so my bifocals on.
Did you need hot towels?
Mm-mm.
Okay.
No, we're good. We just wiped it off. Some things you could even use. She came with a clean face. You can do a clean face before you put
Anything on it?
anything on it. You could wipe it down with alcohol if you wanted to. But these are sanitized. These are individually wrapped, so everything's sanitized.
Do you
Okay.
have lash extensions though?
Mm-hmm.
They're pretty.
Thanks.
So
I need a fill though.
yeah.
Yeah, bet.
My sister does my
Yeah.
lashes.
So this is my Inno pen, okay? I start on the forehead at 0.05. Okay, these are the depthness of how the needles go. Okay, so most pens are like that.
And you always want to put your plastic sleeve on there because you are at this point working with bloodborne pathogens. Which I don't know, Kim, if you were going to suggest to these girls to get their bloodborne pathogen training, but it's just like $10.
You could absolutely.
It says what was the pin number?
0.5. And that's some stuff I showed on that. The one handout that shows the pattern. It'll kind of give you some depths depending on your pen. But definitely because there's no meat behind there. So that's straight nerves. And you guys like me, had to learn all the nerves at one point, right? You're like, how many nerves do you have in your face? So I'm just gonna go down the middle and then I'm just gonna follow a pattern, okay? So I just stamp. And you don't really feel like it's pushing down, honestly. Like,
It's really gentle. Because the pin
Yeah.
does all the work. pretty much.
it does do all the work. I try and be straight up and down with her head so I don't do any tearing. And you don't feel like you're really pushing, but you can see a little bit of blood coming up.
What does that feel like?
Tiny little pin pricks.
Yeah, that's why she's numbed, or she wouldn't be real happy about those. So I'm gonna kind of do a little bit here, and then I'm gonna let you guys do it because you guys need to know what it feels like. Now on the forehead and the orbital bone, I do 0.5. Okay, and then maybe down on the jawline. But the cheeks, even if you were to go down here to her neck, you can go to 1, 1.5, 2 even. Just kind of go with their comfort level. Some people have a very high pain tolerance and some people do not. One of the most important things anybody taught me when I first started being an esthetician, and this kind of changed my life because I was nervous about waxing, and this waxing's my favorite now. It's like boom, 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 easy mind, right? But when I was in school, I like wanted to cry. Somebody had told me like they know that this is gonna hurt. They are asking for this, so don't quit stopping and apologize and just keep going. And that's what they want. Even if they grimace a little bit, just keep going. You can be like, everything okay? They're like, yeah, just keep going. Because the quicker you get it done, first of all, it's time efficient, and second of all, they're gonna appreciate that.
So what's your timing?
I book out an hour for microneedling, and that's numbing time as well. So this takes about 40 minutes. It just depends on how much recoup time you need in between. I give myself an hour. It usually gives me enough time to do it, bring them out, and start my next guest, okay? So get your gloves on, I'll watch you.
Don't get a bad angle.
So when I put the product on, then I stamp it in, and then when I'm done with that, like I usually do a whole forehead, I put some more on. Okay, because you want that product in. So. Okay, who's next?
You're already right there.
No dumb questions. Left side's kind of weird if you're a righty.
So you pretty much did all through here.
Yep,
So
I
I'm
kind of
starting
went,
here.
yep, and go up and down. So you're gonna feel like you're pushing hard, but I mean, it does the work, yep. I won't get any of you ladies' faces in.
How long do you hold it on the skin before you?
Just when you feel like it's already, yeah. Yep, so you feel like it's in there. It goes really fast, so.
Done?
Yes.
That's scary.
Should I keep going?
Yeah, just keep going.
Okay.
Because we're gonna do 2 full passes on her, so everybody can practice on a forehead and. It is very satisfying. Now sometimes, just depends on you. Like I wipe off an area at a time. That way, that the more numbing they can get. Just kind of go the way they can get. Okay, and see how it's on 0.5 and you can move it. Yeah, these are real easy to move. If you want to go around that one orbital bone.
Like around here? Okay.
And pull her taunt that way. Because this skin under here is where it bugs people. So definitely do it here so it hits on a bone. Do not go right there because that's your sinus.
Okay.
So kind of pull it down and get that skin as much as you can. Right on the bone. Yeah.
Like
the
in
nose.
the corner of it.
Yeah, right here in the corner is that sinus. It's a little hurty.
It is kind of hard to do.
Yeah, it's awkward
Right-handed.
on the other
Everything
side.
is hard. I
Yeah,
struggled
and that's
like
why
still
it's nice to
sometimes.
have that rolly chair because you
I'm
can
like-
roll wherever.
Yeah.
And you can move that client's face.
Right.
I do a lot with
And
dermaplane.
not a lot of people are like,
Dermaplane, I go side to
I'm
side.
sorry.
I stand
so
up.
Yeah, so do
I
I.
hold their head around.
Everything.
Because I also like to give one side a break every once in a while. Okay. Feel good about it?
Yeah.
Okay. What's next?
It is kind of a
I
lot
don't
like
care.
microderm.
Okay.
It does kind of feel like microderm.
Yeah,
just
it's a
instead
lot
of
of the
swiping,
same.
you're
Mhm.
just pressing.
Yeah. And this, you don't have to hold that taunt like you do with the suction
Right.
with that, but definitely the eyes. So you did one pass right there.
Yep.
So I would even on 0.5 go down one more.
Okay.
Mm-hmm. And then for the cheeks, we can go deeper. I like it. Especially when you like doing something, it's just fun to see. How do you think her pressure is that compared to the first 2?
It's fine.
Okay. Okay, now
Because
move
basically
it to
once you-
1.5.
Once you put the needle
Maybe.
on there,
Oh,
once
this
you
part.
put the stamp on the skin, the needles kind of
Mm-hmm.
do the work
Yeah.
for you.
Was my pressure okay?
Mm-hmm.
So we've already done like here and down, so
Mhm.
you can start here.
Okay.
Don't go along that jaw yet, but you can
Okay.
do this deeper.
Oh, this is intimidating.
Yeah, and you can
Oh,
manipulate her
sorry, babe.
face if you want to make that straight. Because sometimes people have those wrinkles right by their ears.
Mm-hmm.
I like to pull that out.
made you jump?
Just the surprise of the needles coming.
Oh, okay.
She seems so light with it.
Mm-hmm.
She seems light with it just because you get used to the sound of things and you know.
Mm-hmm.
So why did you say you don't like to drag it again?
I just like I like to do the stamp method. It depends on the tips.
Okay.
That if you can drag it or not, but you don't want to cause like tears,
Got it.
even though you won't be able to see them, just in case somebody keloid scars.
Just like dermaplane, like you want to pick up.
Yeah, you don't want to drag it because and then you don't even realize,
It's
and
like
then you go
days
back,
after
and then you got this like
scars.
rash.
Yeah,
Yeah.
definitely. I've
So-
done that to somebody before, actually.
Well, and I've been doing dermaplane for a long time. I actually did that to somebody the other
Yeah.
day down here because she was real dry, and I kind of went crazy.
Yeah.
Like
And just flaky.
it was
so-
crazy. I was like, oh, this is a good one. And I was like,
Yeah.
oh, actually, kind of.
Yeah.
And she was like, that's fine, because I've done it to her a million times. But
Definitely
sometimes you can get a little carried away. Because, you
Yeah.
know, with dermaplane, I was taught no more than 7 passes.
Mhm.
So sometimes you get a little ham, and I was going a little deeper. And
Yeah, I think I was taught like 6 to 8.
Yeah.
Primarily.
Yeah, it depends on who you learn from and
Yeah, the instructor that taught me though, she did teach us to
go back and forth on
instead
dermaplane.
of picking up.
Really?
Yeah.
It's not the good
I would not. I personally would not. I guess it
Especially
depends
with
on
this
your.
machine, you want it to stamp in and out.
You want it to go
Right.
flush with
Oh
it.
well, I
so,
know with this.
yeah.
I'm just saying like dermaplaning.
Yeah, that's weird, and I'm sure. What brand did they use?
Dermaplane Pro.
Okay. So I was taught by Dermaplane Pro, and they didn't do that, but maybe
Really?
that's something they
I
advanced.
I
through.
vividly remember her saying if you pick up and go back, that's when you were like you could risk like cutting them.
Yeah.
Because you're like removing contact and then putting it back. But
I'm sure it
yeah,
went straight up and
I
down.
generally
Yeah.
use pretty
Okay,
light
Kim?
pressure.
What?
There's a good section to instruct
So-
on because of my marionettes are starting to wrinkle and deepen now.
So when we go over her,
Do you want to sit?
yeah, please. It's a long way down. So when I go over, I wouldn't change the depth. Now the second pass, you might want to try and go deeper and see how she tolerates that, only because you want to see how she tolerates it. So since she has a little bit of a wrinkle there, you don't want to go when it's wrinkled, okay? So definitely pull that taunt and go.
Is she using more pressure than we were back?
She definitely.
I can just
Seems
tell
like
by
we
the
were
sound.
maybe
Yeah.
lighter.
I mean it does the
It's
work.
making like a gurgling noise.
I can just tell
It's
by
like
the
3
sound.
seconds. It's like a quick 3 seconds lift up, 3 seconds lift
Yeah, you can kind of hear. I manipulate people's face probably more, and I've done that with people that when I worked with people that did eyebrow waxing. It's a little hurty down there, so I touch people's face a lot more, and I think that's also soothing too. You know, you're not taught to touch that, but I do. But I just like to keep a hold of them. I feel like not everybody likes being touched, but that's just how I do it. Now, when you do the jawline, usually I'll do both cheeks. I will go back down to like between 0.5 and 1 because this is a little hurty. So now when you're doing the jawline, you can pull that skin up. So it goes right up against that bone. So don't be afraid to manipulate because the older people like me, you can start to see some lines. So just, that way you have something to press it against, but just, you can manipulate it.
So you really don't see a lot of blood with the first pass. Does it get more?
It really depends on the person.
Oh,
Some people,
some
they
people
look,
bleed
some people
out.
just bleed.
Okay.
Bet drinks a ton of water, but I think her skin's just a little bit, honestly, it's a little bit thicker. You start noticing people's skin.
And if
Some people have thick.
Yeah, and you'll see it'll just be dripping down. Some people you're like, dang, what?
Right.
You know, like you're looking, but just some people are.
Pours out. It's like your skin.
So like for example,
There's
someone
stuff
because
it's
continually
like
using
so thick.
retinol, their skin might be a bit
Mhm,
thinner, and they might bleed a little bit more.
Yeah.
Okay.
Exactly.
Okay, so I'm gonna put this back on 0.5. So
And
I
I
wanna
don't
go
use
right
retinol, so I
under
look like
her
colic
eyes.
acid. I probably should.
Nice.
Yeah, I mean that's something that's good for them. They just need to be off of it. Okay, so under the eye, like I had said earlier, just kind of pull that down. That way you can get as much of that skin as you can right against the bone. That way you're not, you know what I mean? Try and get as much of that. I'm gonna get up here. I'm like a bull in a china shop sometimes. There you go. But see, now you're starting to see her nice pattern. See how we're starting to see it?
Yeah.
See, I didn't go quite down to her jawline. There you go.
That's kind of
a
cool
nice
that you
little-
can see where you've gone.
Yeah, because right away, no, but then it starts to.
Right. Yeah, me too. That can see
So
it.
nice. Yeah, it's just one of those kind of things that just takes takes a minute, and then all of a sudden you're just going with it. Okay, now you can do just cheek. So turn that, you can either shut it off and turn it, or turn it to like 1.5.
Got you like a 30-second video. Do you want more?
Hmm.
Do you want longer than 30 seconds?
Yeah.
Okay.
You gonna make a TikTok?
No.
Put her serums
yet.
on. I'll let you guys do that. Put her serum on, like me. I'm one of those I have to do. And then do her whole face.
Okay.
And then start like here. The more meatier parts you can do deeper.
Okay.
Here, put some serum on first because we didn't do that. That way we can microneedle it in. Yeah, there's more in here.
So how deep you can go will also just really depend on the person.
It really does.
Beth's like, I'm tatted. I got this.
Yeah, it's
Like
a different
their
pain
pain
though. Just like
tolerance.
waxing. You'll see people full body
And
tattooed.
I can't do
they
waxing.
can't do
I
it.
know.
Waxing hurts me.
I
Yeah.
can't do waxing either.
I wax my bikini, but that's as far as I'm gonna get.
Mhm.
I did my
Scared.
armpits the other day and I like
I
got
can't do my
mid-rip and I was
armpit.
like,
I can't do my own armpit.
No.
Hair doesn't really bother me.
So as like when I would taught it up or just
Yeah,
go like
well, just like this is fine. Just make sure her ear's pulled over so you can get that skin. There you go, and just go down with it.
that. Ooh.
Alright. Just go straight down with it close to the ear.
Okay.
There's still a little bit on that bone.
Was that just a shock bet?
A little
She's still
hurty.
kind of up by that bone for the deeper pressure. And right away you don't see the color change. So you have to really kind of.
I need to work my way in or
Yeah, just go straight up and down, all the way, yep.
so being around their temple won't bother them? Like doing on their temple area?
Well,
They're
we
more
already went
sensitive.
down, we already kind of did this with the 0.5.
Oh.
So yeah, we're getting to the more meatier parts. Don't go super close to the jawline yet. We'll
This is
definitely
really
get to
cool.
yeah, just kind of just keep going. No, I would go over that more. That's no big deal.
Okay, okay.
Yeah.
I'm like,
Yeah. Yeah, it's not like a major one. Okay, she's starting to bleed a little bit more.
oh, wow, this is fascinating.
Mm-hmm. Yeah.
It's the blood for me.
Yeah, some and you've learned that too with what we do, like, some people want their skin to, or they don't think it's work, or their skin to peel after a peel. Not
Right.
every peel makes your skin peel. So you'll get people are like, I don't know if you did it, you know.
So when do you really start to see the results of this? Is this like a peel where it takes maybe
Well,
that
that's
full
why
28
it's-
days?
That's why, because cell turnover rate is 28 days. So
Right.
that's why like 4 to 6 weeks, just depending on them.
Not on the orbital
Not quite on
bone.
the orbital bone. Go right below it because we already did that with the
Okay.
0.5. Because where the bone, yeah, when it's a little bit deeper, it hurts a little bit. That's why you can do 4 to 6 weeks. Now this brand says 6. But honestly, tomorrow morning, like the next day, I kind of noticed a little bit.
It's so satisfying. The pattern on your face is like,
Mm-hmm.
A pattern.
So now we're gonna go around the mouth. The mouth is tricky because, like,
So should I put more?
yeah. Now put some more on her face so it absorbs it. And people like that. Like you can use the bigger fan one or whatever you want to do. It's just these are throwaway because you're dealing with blood. That way, I don't have to
Right.
mess with them. So rounder mouth is tricky because it's kind of hurty. So I would go between a 1 and a 1.5 and just kind of see how her reaction is. And when we go over again, we're going to do 2s here.
Okay.
Okay? So who wants to go around her mouth?
Oh, not me, but it's not gonna be me yet.
You want me to start it so you can
Yeah,
Yeah.
go ahead. I need to see her reaction first.
Same.
Once again, it's an elective procedure and they're spending money. So,
They're paying for the torture.
mhm. So I'm going to start it at a 1 and just kind of feel what they do. So I'm going to pull that wrinkle in. I'm just going to kind of go right along that border. A lot of people will have those like smoker's lines, and you want to get as close to that border as you can. And that might be something you can do as like an add-on.
The
And
lip.
say we'll do the lip or whatever. Yeah. Just kind of going around her mouth. Was that painful or was that okay?
It was okay. There was
I might go in between.
a couple of pinpricks.
Your lips have so
I have
many.
a pimple right here and it hurts.
Yeah,
It
lips are
hurts.
so
There's so many
sensitive. There's so many nerves there.
Yes, so many nerves.
I learned that from getting laser hair removal. 'Cause When I first started, that part would hurt so bad.
You
I
feel
would
like
really
you can
cry.
feel the inside of your teeth. Yeah.
Get my lip wax like I have to.
You have to like talk yourself into it.
Yeah.
Can't do it. All
Now
that
that I've
hair
gotten it
down
done
there.
so many times, it feels like nothing.
Yeah, but
When I
at
get it
first it
done.
feels like you're getting an x-ray or
Oh, yeah.
something on the inside of your teeth.
And I don't know if this affected it, but I had braces when I first started doing it, so it felt like there was just like too much going on.
That got real hot. That would be a
Yeah.
tricky one. I would probably put like gauze in your mouth.
Some sort of barrier.
Mm-hmm.
Yeah, I was
I
like
used to get
16.
acne
I
really,
cried.
really bad.
Yeah, this is a really. So I went a little bit deeper because this is a little more sensitive than this. So I'm going in between a 1 and a 1.5 here. So just kind of play with it. See if you see like any kind of markings. And that's what's nice because the next go around you go over it. You can go deeper. So we didn't do this jawline. So isn't that nice? So once again, I'm going to kind of pull up so I can use that bone. Just kind of go over it because eventually you're going to see that pattern and see where you missed.
Thank you. I just feel like that's better.
Get closer to the mouth, it hurts a little bit. You can feel some resistance, like you'll start to feel just like with dermaplane, you'll start to feel like a resistance. Okay, we're gonna do some more on her.
What's the highest you would go as far as like the depth?
On this pen, probably no higher than a 2, 2.5.
Okay.
On the body, it's different.
Mm-hmm.
The body, you can go a lot deeper, but
Thicker skin.
mm-hmm. It looks like a scrape, but it's not, is it? It's just where the blood looked like
Pulling
a big old
up.
scrape. I was like, oh. Be like, you're fine. You ever done something and you're like, okay, while you're doing it, you're like, how am I going to?
Like, is it gonna stop bleeding?
Yeah, just kind of dab it, and then later on be like, you have a little nick there.
It's
Do you use
great
like
before you
baking
put on
soda
that.
or something to kind of dab it, or what do you do?
I just
It kind of
let
stops it.
I just let it bleed out because it dries.
Yeah.
And then by the
You
time
just
I put
kinda
the
wipe it
enzyme,
off.
it's
Yeah.
whatever on it.
I get
It's all good.
It's all before the enzyme because I'm
Okay.
like, oh, they're gonna feel that tingle there.
Who hasn't done a forehead? You two haven't?
No, I haven't done a forehead.
I have
Okay, so you guys will share this one. So
I don't think the jawline's been done on this side yet.
there's a little bit mess on there. And now this thing, sometimes I have to do that. Yeah, because you can see where you've gone and then you have it. Okay. So, and a lot of times right under here, I don't know if I numbed you very well.
No,
like
not
you'll
under there.
see,
You stopped literally like right there.
you see when you get older how that's like, see I have a tan where I'm, and then it's white. So like she kind of has a little bit there.
Oh.
So we're gonna go.
Brave.
Now most people I go way down here. Because a lot of your clients don't like their neck. And they want that tighter. So. There's a little bit different sound. When you're getting close to that bone, you'll start to know the difference and feel the difference. So I go down to the neck, and neck can be an upcharge. A décolleté can be an upcharge, because when you get older, if you're a side sleeper, you get your boob lines, okay? So you can do a pattern on the décolleté. That's just sun and aging, because a lot of women show their age right here.
And mine's starting to get that
Yeah,
way,
mine is like laser bit, because I love the sun and I know you're not supposed to. So you can just make a pattern out on something. It's good for hand rejuvenation. A lot of women show their age on their hand.
I feel like that would hurt.
0.5.
On the
Décolleté, probably maybe a 1 in between. Just depends on how much boobs and padding they have right there. Some people it's like straight rib cage, like you can see it. So it just depends.
So 0.5
And this
is also-
definitely with just like with anything armpit waxing and stuff, you can manipulate that. They know they have big
pull it
boobs.
taut.
They know they have boobs, so it's no big deal. Same way with the hands. Hands show age when you get older. That's definitely a 0.5. So those are little add-ons. Like we'll do your hand for 100. I don't know, whatever the pricing is. Okay, and people are like, oh, you can do that. Okay, do it.
right.
So okay, somebody do a forehead. So now we've gone up and down. So now let's go across. So what we'll start is, and then here. These are a big one for older ladies.
Right.
Always check your needle level when
Yeah.
you're switching sections. 'cause you could
Go
accidentally-
back. So this one, pull her nose, get those, because most of the time, now you don't have microbladed brows, do you? Okay, like I do. She did them. So I wouldn't go over where they have the ink.
Right.
But hers, since she doesn't, most people have lines in there when they get older. You can go over that, and it's fine.
What about the eyes? Like on top, like the lids, like right
Now-
under the eyebrow.
I know some people got real nice.
That is one. I didn't numb her for that, but make sure you're against that bone. Okay, so you have to really pull her up because that bone stops. You do not want to get that, okay? So do not feel bad about manipulating her. This does not hurt her.
You would probably do a 0.5.
And just go up and down, then side to side.
Yeah, because
Definitely.
anything deeper than that, your client's gonna come unglued.
Yeah, because this is where a lot of it is. I mean, hers are great.
So doing
But-
this right here.
Yeah, we did during that
That's
pattern
cool that you
thing.
can see it.
And that's eventually you will see that. So if you want to do up here, you can go right along that. You can go into the eyebrow as long as there's not ink in there. Okay. So now somebody go this way with it.
Are you applying serum and then doing it?
Yeah. See, I'm talking.
And
so
then it's back to
and
0.5.
everything.
Yeah.
Yep, back to 0.5, and that'll be one of those things. If you forget it and you go with the depth, they'll come up, and you'll be like, "Oh, that must be a sensitive spot for you." You know, you just don't say, "Oh, my bad." Just be like, "You
I
must
did
be,"
something wrong. Yeah.
because we're all.
I tend to do that.
What?
Like,
I would be
Oh.
like, I did something wrong.
No.
No.
I'd be like, oh.
Well, and that's what I said. That is one of those things you just learn, because if not, they're gonna get mad and you'll start sweating.
Yeah.
Like that's what I would do. I'd be like, you know, you start
Your
sweating.
room gets hot and you're like, dang it.
Yeah, I'm like, well, I'm gonna need a fan on, you know. So yeah, now go lateral.
Okay.
So yeah, that's one of those. Be like, you must have a sensitive spot right there, and just keep going, and adjust it, and keep going.
Okay, but are you ready?
I just
you always give like a are you ready or a soft touch or I'm getting ready
Yeah.
to drop the needle.
That's why I like to have hands on. It gives them a sense they know what's happening.
Okay, so You can stamp down a little bit more with your hand pressure.
Okay.
You want to hear that gurgling of the needles.
It'll go by like a sound.
There you go.
Yeah, get your circle stamps closer together.
Okay.
Okay, and it's hard to see right away, but you can, because there is plastic around that.
I got it.
Here we go. Oh, yeah.
I get it now. Makes sense.
That's why it just takes practice. I'm gonna
Yeah.
make some ice first because I need some water in here.
This makes me want to be a tattoo artist.
This is fun for me, ladies.
Fun for
It's
us.
fun for
Thank
us.
you.
Thank
Fun.
you.
We've
Yeah,
been
thank
waiting
you for
on
doing
this.
this.
Seriously, we've been
Well, I
waiting
think
on
it's
it.
when it's a service you really like.
Yeah.
to do. It gets fun.
Yeah. It looks so cool around the lip.
Yeah, see, she gonna look a little crazy.
It's
So I
almost
tell,
like-
because they'll say, what do I look like? And I'm like, maybe don't go to Sam's. or whatever.
Yeah. It's like when you do
Stan.
Halloween makeup and you do a skull and you do like teeth.
Oh, makeup.
It kind
Oh,
of
I
looks
like
like that.
makeup. So, like, with that.
No
Like
makeup
makeup.
right away.
No, I would say 24 hours, no. Obviously,
Some
like,
people are eager with makeup.
I wouldn't
and
wear
if they are, and
it.
you know that client, and you know they're going to, then definitely educate them as much as you can. I say your skin, like a dermaplane. Tonight, I would just put one of your nice masks on it because your skin wants to absorb. But if you know they are going to for work the next day, I would just say make sure you have a nice lotion barrier because you know when they're going to do it and when they're not.
I'm feeling that.
Fine.
Pokey.
Okay, so we did that one, so we can put some more. No, it's okay. It's one of those things where,
That comes with time.
yeah, it comes with the practice of
I'm
us.
doing the same.
Yep, over here,
Over there.
lateral. Mm-hmm.
You have like more so like the middle of the forehead and over.
Yeah, I think
I
she
started,
started
like,
right with
right
the
above
brow.
the brow.
Yeah.
So do you really do the nose at all?
Mhm.
Okay.
With the pores, yeah.
Oh.
And the nose, definitely 0.5 because that is such a tender.
Yeah.
You can go ahead and press just a little bit more.
Better.
Yep.
Oh, I feel it now.
Mm-hmm.
Okay, it
The-
kind of gives
the-
back,
the back,
and it makes
yeah.
a different sound. You'll learn your
Yeah.
machine and know the sounds. That's a nice groove as well. Do you think this is something you guys would like to do?
Yeah.
Oh yeah, definitely.
Absolutely.
I can't wait.
I want to do more so of the medical side of this.
I can picture
It's so
Dharma
nice.
playing with one
I'm
of these.
obsessed.
I know their skin is gonna look amazing.
Well, you're really helping somebody.
Yeah.
You know, it's just not your relaxing facial. You're really helping them.
People
It's not
can
as
actually
super
take it
invasive.
serious whenever you're doing stuff like this, like
Mm-hmm.
basic things.
And everybody likes the basic. But then you're gonna have people that want to do, that have aging skin or scarring, and this is a
I
good
don't know
one
why,
for
but I
your-
feel like when I do it, you really bleed.
I felt like she bled more on that side when I was
So
doing it too.
you can lighten up on your pressure just a little bit.
Okay.
As the numbing starts to wear off, the capillaries open up a little more.
Okay.
So it's going to produce a little bit more blood. So you have a time frame from your 20-minute timing. You got about 30 minutes or so before they,
Numbing
yeah.
starts to.
Yeah, and we're
Exactly.
just stopping and talking.
'Cause we're
letting
talking,
yeah.
things go, but yeah.
Oh, bad.
So just,
Oh, okay.
she knows she, go on
Let me
down.
keep.
Just go on
okay.
down all the way
down?
to like here.
Okay.
And then you can do her orbital bone. Who hasn't done like an eye socket?
None of
Okay.
it.
Yeah, so keep all that at
Save it.
0.5.
How's that pressure?
She'll let you know if it doesn't.
Your lashes are great.
Actually, they need a, I'm ready to get a fill. But when they're full, they're awesome.
They look good right now.
Mm-hmm. The same way with this side, there's that bone. So a lot of people have that crow's feet. you can pull that and manipulate that out a little bit to get those.
Underneath it.
Mm-hmm.
Yeah, I'm starting to cry. So if there's wetness on the eyes, I'm just getting little tears there.
Yeah, and then when you're working on there, like when she microblades me, my eyes cry and because she's on my sinus.
Is this similar to like a microblading pain?
No,
I
it's
doubt it.
different.
Yeah,
That's different.
yeah. Kimmy can tell you because she's had her eyebrows microbladed. And
There's
then
some
she
places it
she-
doesn't bother me, and some places I kind of want to punch her in her face. You know what I mean? But I can microneedle myself.
Really?
So that's
Yes, I know.
how
That's why I can't wait.
I can numb it and microneedle myself.
Wow.
And it's tolerable.
I'm excited
Yeah.
for that and a dermaplane.
It's
I just
tolerable.
want to see the whole
Okay,
Are you
so
starting to tear
go
up
under
the
this,
numbing as well?
under here.
No,
Under here,
I think just because I'm
We're pushing a
sitting
lot on her.
here.
Oh,
Yeah.
okay.
So go underneath there.
Her body starts leaking.
It's had enough, and we're working around her eyes too, so
Yeah.
there's a lot of sinus. And we're pushing down with our hands too, so.
doing big stuff like this. It's pretty cool.
Cool. Yeah, kind of keep, now you kind of jumped a little bit, but try and keep your circles. That way, if you miss this area, you'll know
Yeah.
it. And then if you think, oh, I didn't hit that, then go over it right after you finish your pattern. So it's not like you overlap, you just keep your, like this, just keep your circles. Like, see the plastic, you kind of overlap that plastic a little bit. Just kind of keep going with the pattern. Like, if not, you know, when you're done, you'll see all these little white areas.
Oh, okay, that's what you're
Okay.
saying.
Those are those white areas are indicators of
Where
spaces
we've
that
missed.
you've missed.
Oh, okay. I was
Yeah.
wondering why it was showing up like that.
Yep. And then they'll see that too. They'll be like, oh, all that pain.
So just follow through, basically.
Yeah, just kind of in your, I kind of like that little music on. I mean, this is different because we're taking turns with it. I like to just kind of, it's kind of peaceful, honestly. It's like cathartic for you, you know. Cute little romper.
Mm-hmm.
Okay, I like this.
Okay, now,
When you rub your serum,
yep, put serum on.
I would just do
That's why I keep that
cloth.
cloth there so I can lay that down if you wanted to, because sometimes you just get awkward.
How does this feel going on the skin? Is it like,
A little tingly.
It feels good
Feels
and
good.
cool.
okay, that
It's
sounds
cool,
good.
because your face will get kind of hot with the numbing.
I didn't put
I think
serum on
that's
that
the worst
side.
part of it. So now you can put it to 1.5 and go down on her cheek.
sideways, you mean?
Yep, lateral. Yeah. Or horizontal.
You said a 1.5?
Yeah, and then when you get more to like her.
I'm gonna can I see you do it first.
Mhm.
before I do it?
Yeah.
Cause yeah.
Yeah. So 1.5. Old people think. When I was 4-day girl, I had perfect vision. And it was like, what's happening?
I've always had that vision.
Not cool.
Same.
Not cool.
I just can't see period.
I thought it was my superpower. So this guy's annoying, so I'm gonna move him around.
Because I feel like they dry out my eyes pretty fast.
Yeah. I have to wear dailies, so I throw them away, then I make them new every day. Yeah.
Now, if this was like acne scarring,
Yeah.
I mean, you could even go a little bit, like this one only goes to like 2. I went up a little bit more, so we're gonna see.
You do kind of go, can you kind of go deeper with each pass?
I wouldn't up here,
Right.
because that's the one you'll see push off,
The cheeks.
but definitely, you know,
And the meteor parts.
yeah, the meteor part. So I dropped off about there. I manipulate a lot. That way I know. She doesn't have wrinkles by her ears yet, but that working with people enough, you know where the wrinkles are. So I'm just following a pattern. Up and lift.
Do you have a lot of microneedling clients?
It goes on spurts. You know how people do.
Right.
Summertime's weird with services like this and laser, and there's a lot of people like to be in the sun. So you see a lot of this stuff in the winter. I'm gonna go back to 1.5 and go around these. Right around her folds, because that's what bugs her. So whatever bugs that client, definitely pay more attention to. So we can go down this jawline, turn it back down.
Hi.
They're doing really good.
Are
Okay,
we?
come back on here.
Kim, Leslie.
Hi.
Nice to meet you.
How are you doing, sweet pea? Getting
So-
your skin worked on.
They're doing really good. So I'm gonna switch
No,
you.
I watched a million videos on this last night so I could see.
And are we going
What was
horizontally
going on?
again?
Yes.
Okay.
Right around.
Hey, girl.
Usually that I kind of go
How are
horizontal
ya?
with it anyway.
Okay.
Now you can see
Busy
the
as all get
gapping.
out.
You can see a little bit of gapping here. So, but definitely manipulate that skin so you're right up against that bone and not there.
Amazing.
And that's where you
We
want
wanted
it.
this so bad.
Yeah.
Yeah, yeah.
Okay,
'Cause
so
it is a little
I've
tough
got
like that.
questions after
Yeah.
watching all of my. We talked yesterday, so I was like going through and watching all these videos. and-
For sure.
Okay, so do you put on any ointment on the skin? Because I saw several of videos have like, and I've heard about like placenta.
Yeah,
and
yeah. I'd answered some of them because she's
Okay.
like, we have questions.
Yeah.
Like this is a basic
Okay.
microneedling. We're just using hyaluronic acid. So before we do an area, we put it on, and then
Okay.
right after we do it.
Okay.
Same way with like the placenta, PRP.
So you can use different things. You
And that's
don't
an
have
upcharge.
to use the placenta.
No.
Okay. I
No.
just thought, I'm like, whose placenta are they doing?
Well, it's like sheep.
Well,
it's like
I
a-
know,
it's
but
like the snail
still, I'm
slime.
like,
I mean, people like that.
I'd be like,
I mean,
can you
that's a-
save my placenta next time?
Yeah.
Hold on, hold on.
Put it on my skin.
Kim,
People
she's
do
getting close to the jawline,
Mhm.
so you need to make sure to let her know not to get on the jawline. And then, if you
On
can,
the
let the
bone.
pen let the pen do the pressure. Don't lay your hand on my face because at this point my face is on fire. So your
Okay.
client
Yeah.
is going to start.
She's getting to the place where we would already be done. So she's kind of
Right.
over it.
Yeah. So
Okay.
just you can pull the skin taut, but don't lay your hand with
Right.
the machine.
I see what you're saying.
Okay.
So that might be
So you kind of go in
I was
like
watching an
this.
Esti last night do it to herself. She was doing it at home
Mhm.
treatment. And I'm like, how does she just like?
You can do it to yourself. She's been like her numbing is wearing off right now, so that's why she's.
So you numbed before.
Mhm.
Guys, that is it the same numbing cream that you put for brows?
Yeah.
Okay.
So if you have a doctor heading your medical spa
Mhm.
side, you can get that person to write a good BLT cream for you.
We'll write it down what
Okay,
we have
thank
on
you.
ours.
Thank you.
So after a while, it will start still wearing off. So that's where
So
she's
that's
at.
something you don't do the service unless you have a numbing cream.
Oh yeah.
You wouldn't be
Yeah.
able to.
I
Tolerate. Yeah, you wouldn't. You wouldn't be able to tolerate it. So
So
when
where
you're,
do you
The
stop?
lady last night on
I just stop here. So what I do is I pull that skin up and then I go.
So I
Above
probably
the
should
jawline.
Instead
do
of I'm
it.
not
Yeah.
under there.
Right.
Yeah. So I go. I try and go on that meaty part.
And
We
we
got
use
it.
different.
So
feel
I just
that.
wasn't pulling it taut
Yeah,
enough.
just kind of lift it up with one hand, like she
Yeah. So
said.
not on the bone precisely, but just like
Yeah,
just
just
a little.
right
Got
above it.
it.
Yep.
Okay.
Okay. You
Well, then
want
I
to
feel
try
like
it
I'm
past
probably
that
done
way?
with that area. But
Okay.
yeah.
And then let's try it on there. Then
Okay.
we know. So you can see and you can see
Okay. So
where we were
rub
talking.
your serum.
So how long will her face be red or irritated?
Just
I know
really till
everybody's different.
tonight.
Oh, okay.
she might be a little red tomorrow.
Okay.
And then her problem areas, like that would bother her, is like here, so we go over that again. That will start to get dry. You'll have places where your skin will like kind of want to peel off, but not like a peel. It just looks like really dry skin.
Okay. So
now over
after
here.
watching
And then
the
so,
video,
yeah, put more serum.
you guys probably already answered these questions, but I'm just,
No,
like,
ask
researching.
away.
I noticed that with different pens, there's different needles.
Mhm.
Like different, like some are spread apart, some are all together.
Yes, and that's what I was telling them about the drag method. I do the stamp method, but that really depends on the tip needles that you get. Like this one has like 9 maybe.
Okay. Do you find that you have like a favorite number? Is that like a personal preference eventually, or?
Yeah, it's just, I mean, I've only used this pen, but this pen
Okay.
is great. I know you got some slimies, don't we?
Yeah.
So you can rub off a little area to pull it up if you want to.
So like that is our
Okay.
target. but-
So, yeah, I know that was kind of tricky. So I don't want to go below here. So I just kind of use my thumb.
Okay.
And just go pull that skin and use that meaty part of her jaw. Because that's that skin.
Okay.
So I just do the meaty part of her jaw, not right on the bone because that hurts.
That's what the lady in the video was saying. She's like,
Yeah.
oh, I caught my chin line. And
The-
then she had a little bit of blood because she said that it was bone or whatever.
Yeah, the right here and like up here probably hurt the most, right at the top.
Is that now? Is there anywhere that you don't do? Because I'm just thinking like, okay, like
You can do the neck.
carotid artery. Or
No, you're fine because it doesn't go that. It doesn't go that.
You just see like such.
You can do the neck, the chest, your hand, you can body area. You can
Yeah,
do your
you can do
body.
stretch marks. You can get a pin
You
that
can
goes.
do C-section lines.
Yeah, so you can do
My atlas might go away.
like this is a real superficial one, but you can get one for a body area that goes a little bit deeper.
Okay.
Now I say I usually do like about here up
Okay.
because people don't like their.
And that helps get that
Mhm.
away.
Mm-hmm. It
Just
helps make that taunt because you're
okay.
making collagen
that
and
just
your
like
body's
water?
repairing
Okay.
itself.
It's okay.
So I told her it just depends on how you'd want to do it. Usually I do about halfway neck, but you can do a décolleté because women age here.
Oh yeah.
That is a whole separate one,
Okay.
or it's definitely an upcharge.
And then it's packages of 3.
Yes,
Okay.
definitely doing packages 3. That's how they're gonna get their best.
That
That's
side's
the best
easier
result.
because I'm right-handed.
Yeah, that side is easier. Yep.
Okay.
Better. You about over it? You doing okay?
I'm over
You're
it,
numbing.
girl.
Doing okay?
It's half and half right now. It's
Okay.
I'm
Right.
glad
Do the
she's in
cheek.
pain because you know this girl put me in pain through my microblade.
No.
She's like, "You doing okay?"
She
I'm
acted like I was a
"I'm good."
weenie. I said, "Come on, punch your face." She's like, "You're being a weenie." I said,
It's so different to
you
have
wanna do
her
a
on the
cheek?
table.
Am I going?
Horizontal.
Design
Yep, and you can
with
see
that
where
spot.
we've not gone. So definitely go
So
along
if
there.
somebody's getting this done, do they get like their full face treat? Like that's what this is? They
I
just
would
come
do
in with a
if
hat?
you're like, it's just however you
Well,
want to
maybe
advertise. Like
not
if some people
completely
just
turn
want to
your
run
red
their,
'cause your
I would
face
do
is
their whole
irritated.
face.
As far as you.
I mean, I definitely wouldn't.
I'm just asking questions in case you
I
guys
would
didn't.
definitely say it's a whole face thing.
Okay. And then like a décolleté would be a décolleté
Does my
or a
sewing need to
face
be on
but
a
an
one?
upcharge.
yes,
'Cause
and
it's
you
almost
look
like
at that
this
way,
is
and you can do
A lot of
hands.
area.
Sorry, what'd you
Just
say?
women.
Do you want the
Yeah,
setting
well,
on
that's what
one?
I told her.
Or less?
You know, just kind of.
Hold on, Kim, she's got a question
What's
for
that,
you.
hun?
Am I putting the setting on 1?
One
Or
and a
less
half.
then? Okay.
1.5. This
It
is a
was-
meatier area,
Okay.
so I wouldn't go down with it or like start
Mhm.
underneath that. So this area
Okay.
is about 1.5,
Okay.
and go
That's what I was
horizontally.
noticing too, is they were like adjusting the
Mhm. So I gave them a paper, which is a really good thing as
Oh,
well.
awesome.
Because
Thank
it shows
you.
the pattern. It's very similar to the microdermabrasion pattern. And then this will talk about where your dots
Oh,
are.
that's
You
cool.
can go a little bit deeper. See, and this says like, yeah, it says 0.5 to 2.0. I just start it at 1.5 and kind of see how they, because she's not bleeding that bad, but you'll have people that are bleeders. It just depends on how thin their skin is and whether, like if they have rosacea, which their veins are a little bit higher to the surface.
Okay.
So
Can I
that's a
have
good-
this one?
Yeah, these were
Sweet. I'm gonna laminate.
these were my extras.
Hey, laminate them.
That was a big one, the contraindication. So PRP, if you could do PRP, which is the vampire, I guess you could use that vampire.
You can't say vampire.
Yeah,
Well, all of our
you could
clients
call
have
it
been
something
asking
else.
about
Yeah.
vampire facial. and
We
I'm like,
call it
"No,
the True Blood
Yeah, we
facial.
call it the True Blood
True
facial.
Blood facial,
So
okay.
it'll come after you for the vampire
just
facial.
because it's patent and trademark probably.
Kim Kardashian
Yep.
kind of stuff.
Yep.
So they really will.
So we could come up with our own name.
Like another salon would be like, you know, that
Yeah.
kind of stuff. You know,
Yeah. Oh yeah.
So, but what you need to do is, if you have a doctor, you need a nurse, somebody that's certified to draw blood,
Or a phlebotomist.
phlebotomist, because they draw the blood. You're doing
Talk to
good.
my sister.
Yeah, they draw the blood. They put it
Mhm.
in a centrifuge in it until it's done.
I have a nurse.
And then you have the plasma. So we use like a plastic syringe and just kind of do a little bit at a time. Only because I don't want it sitting out here because it
Oh.
starts to get coagulated a little
So
bit.
you basically use that rather than the blood.
Mm-hmm. And that's a major upcharge.
Yeah.
Yeah,
Because
you're
dealing
drawing
with-
blood.
And you're dealing with bodily fluids
Right.
too, which is why I use these throwaway things.
Okay.
Because you can use those one
The
fan
ones.
brush,
Mhm.
but you really have to sanitize them. So you can
Right.
just buy a bunch of these little
Okay. I
throwaway
think we'll get
guppies.
into this first, and then see
Yeah,
how you guys
but
are
you can look
liking it,
into
and
that
then look into
slime,
other
that snail extract. You can look into that.
snail.
The slime. The sheep placenta. Yes.
Okay.
And then what is we use, we have one that's a higher, and it's a hyaluronic acid. So
Okay.
it's different.
Yeah. We use the plant stem cells.
Mm-hmm.
Yes, that's what my
Yeah.
doctor over in Carmel. They're all about stem cells,
And honestly, yeah, because it just helps your skin rejuvenate.
and that's
itself.
what this
It's a-
lady
it's a
last
difference.
night was
Mhm.
placenta and stem cells, and then she like mixed them together and was using that.
Well,
for
just
her.
like any of the facials these girls do, you can kind of see what they need the most of,
and that's what
and
you
they
do.
can do. Like if you have basic line things, of course.
Well, that's
another
what I
level.
was thinking, like a basic line
Yeah.
just to get us started. Get
Yeah,
them
just kind of when you do a
comfortable.
facial, you're like, you're more sensitive skin, so I'm gonna use this line or but nice
Okay.
base rate, but you
Okay.
can make a cocktail and you can even do like things in one area and other things in another
Different.
area.
Okay.
Did you already get the machine?
No, I have not yet.
Okay.
That's what we were talking about.
Yeah.
I have an appointment today.
It's okay,
A phone
Sassy.
appointment today with collagen pen, and then I've got a couple estheticians that have given me some sites where they've gotten pins
Mm-hmm.
that they really liked because they didn't go through a doctor. Like they're on their own, more to say,
Mhm.
than rather like having like
Well, that's the
collagen
thing.
pins like $3,500.
Yeah.
That's why I said you're gonna spend
That
around
one,
3 or 4.
that one was like 4K.
Yeah, I couldn't
Yeah.
quite remember, but a lot
So
of
that's
that.
why, like, I want to do the research, and I wanted to ask her all these questions because there's a million pins out there.
Mhm.
So I just want to make sure.
Did somebody mention an Inno pen?
Nobody
yours?
mentioned the InnoPen. I got a
Because it is a
doctor-
good one.
Doctor pen.
Yeah, I've heard of that one, but I don't know.
And I started looking them up, and there's like a million different like heads, and so I was like, I'm excited we have this today.
Yeah, even the
so
pin,
that-
even the pin heads are like $35.
Yeah,
Yeah.
so
it's
we're gonna have to take that. Like that will be
factored
on
into
to the
the cost.
client.
Yeah.
And so the back bar charge for that would come out so that we're not paying for
Mhm.
that. And then you guys would price